Well, good news for those waiting for their COVID jab. The Health Department has confirmed that those who are eligible can go to any vaccination site to receive their jabs. This as government ramps up its vaccination rollout amid a steep surge in COVID-19 cases. Meanwhile, in Cape Town, officials have committed to the noble cause of ensuring the homeless are not left behind. Our reporters have been on the ground monitoring a number of sites for us today. Heidi, Giokos in Johannesburg, and Cape Town reporter Ronald Masinda joining us now. Good evening to both of you. Thank you so much for joining us. So, Heidi, I'm going to start with you. So there's a huge push now to actually increase capacity. It seems a shortage of vaccines is not our problem. It's a potential shortage of people waiting to get those jabs. What did you see at sites today around Johannesburg?
Yes, certainly, Sally. We've been hearing from the National Department of Health for some time now that the uptick in those that are eligible to get the vaccine, those 60 and above, has dropped significantly in the past 2 weeks. We know in the last week they've seen an uptick of people coming in, but this is because a lot of them have come in to get their second jab of the COVID-19 vaccine. That's the Pfizer vaccine. But today we did see an increased amount of people coming in, and the reason for this is because we know registration has opened up for those 50 and above, and even though the Department of Health said that they will have to wait until the 15th of July to get their vaccine, we know that sites are already starting to vaccinate those 50 and above, 60 and above, those in education staff. And, of course, today the law enforcement officers also began with their vaccine. What's crucial here and critical for everybody to remember is that all you need to do is register on the electronic vaccination data system, have a proof of SMS for registration only, and you can go to any public or private vaccination site, whether you have medical aid or not. You will be assisted at private vaccination sites, as the Department of Health has urged private sites to take those that don't have medical aid to be assisted. So it seems as though there's an effort to ramp up vaccine rollout significantly, especially here in Gauteng, given the alarming numbers. We spoke to the district manager in Ekurhuleni regarding vaccine rollout. Let's listen to what he had to say.
Since we started from the 15th of May this year, we have seen that in the last 3 weeks, the uptake was starting to drop a little bit. Then there was therefore a need for us to relook at the strategies that we can put into place to ensure that we enhance and encourage a lot of our eligible groups to come through to our vaccination centers. So as a province, Heidi, as you are aware, from word-go, we have been saying that even when you are not registered on the EVDS, if you meet the criteria of being vaccinated, you are 60 and above, you can walk through to our facilities. We have got a dedicated team of health professionals who will assist you with the registration. And at the moment, we are talking about those that are 50 and above who are also coming to our facilities starting from today. We are accepting all those, and even when they are not registered, they can come through. But because those that are 50 and above are a lot more technologically savvy, we would encourage them to register, prior to coming through to our facilities, because it makes the process a lot more easier. But registration, it's not mandatory. As long as they do qualify, they can come through and then they will be vaccinated and assisted accordingly.
All right, so that certainly is good news. Ronald, I want to bring you in from Cape Town, and this is the plan to vaccinate the homeless, which is a great idea because they are a vulnerable sector of our population. But I would imagine logistically there are a lot of challenges. Talk us through that.
Yes, indeed, Sally. There are a number of challenges that lie ahead. The main one that was mentioned by Dr. Nomafrench-Mbombo is the issue of many people not having IDs. Those who are supposed to vaccinate from the ages of 50 to 59 have not had IDs for many, many years. I mean, we spoke to people who've been living on the streets for over 20 years, and they don't simply know where their IDs are. And many of them don't even know the dates of births. And these are some of the stories that we heard from people that we spoke to. We do know that the Western Cape Health Department and civil society groups will try and accelerate the process by speaking to the Department of Home Affairs to assist those who want to be vaccinated. But even more astonishing, Sally, is that a lot of people who live on the streets are are against taking the vaccine. They say that they've heard harrowing stories about the side effects many of these vaccines have caused, many saying that they will rather not take the vaccine. But the health department encouraging people to take vaccines. They say that this is because of a lack of awareness programs. They want to empower people living on the streets to have more knowledge around issues of COVID-19 and vaccinations. But we also heard that the important thing is to get people who are homeless to be vaccinated because they are vulnerable people. They are prone to many chronic illnesses, especially during the cold winter months in Cape Town. We also know that one of the biggest issues that the health department is also facing is the issue of contact tracing, where a lot of the people who live on the streets are difficult to monitor because many of them have been likened to nomads, so people who are moving around and constantly not being known where their whereabouts are. But we earlier on we spoke to various people. We spoke to Abdul Smith, a man who's been living on the streets for over the past 19 years, as well as a representative of the homeless, and this is what they had to say earlier.
The asthmatic, my lungs getting cold, so my lungs is so I don't like that the weather, whatever is in, but sometimes I feel like I stay in my tent.
The homeless client, we do know that some of them, they don't even have IDs, and it means that it will quite be a challenge.
What they need to do is to actually educate people about what the vaccine is, because most people on the street at the moment are very cautious about the vaccine. They don't have the access to the information, so all the rumours and all the myths that are growing around the vaccine are primarily their thought on the vaccine at the moment.
Yeah, that issue of concern about the vaccine is really important one. I remember, Heidi, you were telling me earlier, the Department of Health is actually putting out more and more messaging just to help people understand why they don't need to fear the vaccine. But Heidi, I do want to speak to you about the fact that we're trying to up our vaccination, particularly here in Gauteng, at a time when the caseload is increasing exponentially every single day, and many people voicing concern that if they have to queue inside, particularly for their jab, it's a potential super spreader event all on its own. You know, and this comes at a time when the mayor of Johannesburg, who contracted COVID 2 weeks ago, is in hospital. He was admitted to hospital over the weekend. So it's very present in all of our minds just how very dangerous this virus can be if you're not vaccinated.
Yes, certainly, Sally, and the fact that you're going to a vaccination site to get a COVID-19 vaccine to protect from severe COVID-19. Many people are possibly not pitching up at vaccination sites because they're a little bit worried at the increasing numbers, particularly here in Gauteng. When we visited one of Dis-Chem's main vaccination sites here in Centurion, this has been raised as a huge challenge and concern because administrators, vaccinators and other admin staff that facilitate the whole vaccination process have tested positive for COVID-19 over the last couple of days. And this, of course, is going to slow down the vaccine rollout significantly. So we do know that Dis-Chem says this is a huge challenge that they are facing, and this is going to slow down the process because instead of one vaccinator vaccinating over 40, there are now only 6 vaccinators instead of 10 vaccinators. And this is a huge challenge for them, and they just have to wait for these vaccinators to, of course, recover and get back to these sites. But it's a huge issue. We're seeing it a lot. Even Gauteng Health is assisting with transport to various vaccination sites here in Gauteng, as many people raise the issue of they don't have transport to get to these sites, but they also have to make sure that that's measured to avoid any super spreader events. But resources are extremely stretched here in Gauteng, and this is possibly why we're seeing not as many vaccines administered per day. But let's listen to Lizette Kruger, who is from Dis-Chem.
Our vaccinators, administrators, people in the pharmacies are also testing positive for COVID. So, I mean, and all the rules apply to them as well. They have to isolate. Luckily, most of them aren't that sick, but they still have to isolate. So we have a bit of a constraint in terms of the the personnel. That's the reality of the third wave. And in the sites, I mean, people get upset because they're not seen between 8 and 10, but maybe 10:15, and they have to wait in a long queue, and then they don't social distance. So it's a challenge, and we try as much as possible and as best as possible. But if I can please appeal to the community, we try and we will assist as far as possible. But if you get to a site, be patient, you will be seen. If you get a number and we say that you will be seen, you will get the vaccine.
And Ronald, I suppose in the Western Cape, which of course is second to Gauteng in terms of climbing infections, but really only a fraction of what we're dealing with here in Gauteng, there's probably a little bit more time to get people vaccinated. So it's good news that the government there is looking at who else, in terms of vulnerable populations, they can vaccinate. The issue of campsites for the homeless, I understand it's been put forward again, and of course we know that really didn't go well when we had our first hard lockdown last year. Tell me a little bit more about that conversation.
Yes, indeed, Sally. So in as much as the Western Cape government is trying to vaccinate people, they also want people to cooperate. Now, the issue of campsites was raised earlier today, where the homeless felt that they don't want to be in a situation where they were put last year, where the city and the government, the provincial government, tried to minimize the movement of the homeless, making sure that people stayed in one setting where they would be provided regular food and water and adequate sanitation. And that was really to just try and minimize the risk of COVID-19. Many of the homeless actually said that this was a bad idea. They felt that, their rights were violated. They were only provided food when the authorities felt like, and that they actually want to be free. They want to be out in the open spaces where they can, feed themselves whenever they want. And they felt that a lot of the time they were abused during these campsites. One of those campsites was a campsite in Strandfontein, where we also heard of stories of a lot of the law enforcement that was involved there, confiscating a lot of the belongings of the homeless, including, in some cases, the IDs. And the issue of IDs is one that continues to worry authorities, as if people should be vaccinated, they should have some form of identification. So there are really worries around those issues, and also not only just with the homeless, but also with people living in rural communities. One that I visited last week, where among the other issues there, farm workers not also having the correct paperwork, and people not aware of some of the programs that are in place around vaccinations. So there were similar conversations from farm workers similar to what we heard from the homeless people, also fearing taking the vaccine. So there certainly is a lot of work that needs to be done on the ground to ensure that people know perhaps the ins and outs of the vaccines, the pros and cons, before sadly they do, get involved in the process of being vaccinated.
Yeah, it's so important that communication is opened up. Ronald, Masinda in Cape Town, Heidi Giokos in Johannesburg.